Hi, I'm Dr. Susan Julius. I'm the Regional Medical Director for Avenues of Louisiana. So on the topic of is addiction genetic, we first have to realize that it's a disease. And many people think of addiction as a choice or a moral problem, and that's not true. The disease of addiction is centered in the brain. It's in the midbrain, and it is a illness that is chronic, progressive, and terminal if you don't get help. It is linked to genetics with a 40 to 60% risk. So let's break it down. We do know from evidence-based medicine and science and research studies that the disease of addiction is 40 to 60% genetic. Okay, take a breath. I know that's pretty rough to hear, especially if you have a parent or a grandparent that has this illness. Epigenetics is a big-time word, but let me see if I can break it down for you. What happens is when people have the genetic risk for a disease, what that means is your DNA codes for proteins, and proteins code for work in the brain at receptors, and different receptors are used with dopamine, norepinephrine, serotonin, glutamate, GABA, and many, many other neurochemicals that go into the disease of addiction. What happens is as the person uses these drugs, they actually genetically change the chemical structure of their brain. And this is one of the bases that the disease is passed on. So every day that we use, and the longer that we use, and then with environmental stress factors, DNA is changed over time. And this is how the disease is passed from one generation to the next. We often see it passed with a 3-time risk from mother to son and father to daughter. So if you have a family member or you're an offspring from someone with this illness, there is a risk that you inherited it. But if you are raised, I call it raised in the rooms of recovery, whether it might be SMART recovery, Celebrate recovery, the 12 steps fellowship of AA, NA, OA, SA, GA, Overeaters Anonymous, Sex Anonymous, Narcotics Anonymous, Alcoholics Anonymous, Overeaters Anonymous. If you raise your children up in these rooms and you don't use and you stay abstinent, that increases their probability that they will not be sick. And this is where environment comes in, all right? So environment has tons of factors. People who are raised in homes where there's a lot of chaos, where there's abuse, molestation, incest, low socioeconomic factors, people using in the home, these all affect whether your children will have the risk of developing addiction, or yourself even. The time and date of how early you start using, the drug that you use, the route that you use it in, whether it's oral, inhaled, insufflated, or gone through the nose, or injected, or put in your skin intramuscularly, or through the tissues of the skin called skin popping. This all affects your risk and how quickly you can develop the disease of addiction. Stress is a huge player in addiction. If you're raised in a bubble and you don't have stress, I mean, who is that? That's nobody in life. It improves your probability of staying sober, but no one can live like that. So if you just failed a huge exam in college and you're not going to be able to pass, or your children are not doing well in school, or you lost your job, or you just got married, or you got a new job, these are all stressors. And stress actually drops dopamine tone in your brain. And if you have the probability of this illness, when dopamine drops, that's when we crave. And we turn to substances to alleviate the stress, whether it be alcohol or marijuana or opioids or coke or sex, food. So genetics, environment, and stress are all components of the disease of addiction. So a good question comes to mind, you know, if your mom or father or someone else in your family has this illness of addiction, should I not pick up a cigarette, a drink, or smoke a joint or pop a pill of some type? And my answer would be to you, yes. Even though you could be part of that 40 to 50 or 60% that doesn't have addiction, what if you are? I would rather you live a healthier life and avoid those substances than increase your risk or probability of just taking that first choice of picking up a drug, because after that there's no choice involved. If the substance that you're using or the behavior that you're using gave you great satiety and clicked and made you feel phenomenal, that's a substance you shouldn't be taking. If you or a loved one in your family or you have a friend that is concerned or could be having issues with drugs or alcohol or other behaviors or substances, please turn to our website. We have wonderful resources, we have podcasts, we have articles, and also pick up the phone and call us. We're here to help you.